have seen the issues that are happening in Kirinyaga, which started very well as an industrial action, but now it is a lockout. And this is the first time this country is experiencing a lockout, both in Kirinyaga and in Laikipia, where the governors and the counties and the county government, they are being mismanaged, they are being misadvised by technocrats, but they are also refusing to engage with the employers. This is unprecedented in labor law. It is also unprecedented in labor history. And let me make it very clear to them, to Governor Waiguru and to Governor Ndiritu, we will not massage your ego. We will not massage your ego. If you have an inferiority complex because of doctors, the best we can do for you is to treat your inferiority complex. But we will not massage your ego. And we want to make it very clear to any single governor. If you have an inferiority complex, we as doctors in Kenya are professionals who are trained to treat people. We are going to stick to our mandate to treat people, including treating your inferiority complex. Massaging your ego, that one we will not do. That one we will not do it. So if they are not interested in offering services to their citizens, which is the mandate of the governor, then they should look elsewhere instead of bringing these frustrations onto professionals. Professionals in this country must be respected, and not just doctors. All professionals must be respected. Professionalism must be placed above partisan politics. And we are very dismayed by what has been going on in Laikipia, where the governor is even comparing the number of doctors with the number of facilities. This is idiocy of the highest level. I mean, this is unprecedented of a governor, where they are saying they have 80 facilities and they have 100 doctors. They want to reduce the number of doctors to the number of facilities. Kenyatta National Hospital has 1,200 doctors, and they are not even enough. We have many places. In Berlin, there's one hospital with 3,600 doctors, the country's largest hospital. So we cannot start engaging in this partisan, deep-seated ignorance. If governors have issues, please keep those issues to yourselves. We are going to engage in things that are geared towards achieving universal health coverage, accessing skilled professional services to this country. And that is the path that we want to follow. So even as we continue to engage in lockouts, we want to request the citizens in Laikipia and the citizens in Kirinyaga, hold your governors accountable. Your governors do not have your best interest, because the doctors will always have options. They can be returned to the national government, a process that we have already started. But you, as a citizen in Laikipia, in Kirinyaga, you will remain there without a doctor to attend to you. And we are not going to bring any. So these governors must be put to a stop. And as doctors, we are not going to massage their ego. There are huge gaps within the county governments, which the county governments cannot claim not to have money. And we are engaging as an annual delegates conference to make very serious statements and resolutions on what we are going to do about the state of unemployed doctors. First, we have already engaged Parliament, even as we speak, and there was already a bill that was being presented, and I think most of you had already seen a report that was being discussed out of KMPDU's engagement with Parliament that was being supported by nearly all MPs. And the report is very clear that Kenya must gear towards improving the doctor-patient ratios. And the doctor-patient ratios will not be achieved if we do not employ these doctors that are leaving. But more importantly, there is also a threat that we want to inform the country about, because if you do not employ doctors, then it means that you do not care about the security, health as a security. What it means is that these doctors then are forced to go and engage in other income-making activities. They may open clinics, and they may not give you quality, because then there is no apprenticeship. Public health sector plays a very key role in the regulation of professionals, because as a doctor, you must work under other doctors who are experienced, so that within 5, 7, 10 years, you are equally experienced now to work on your own. So it is not like other professions where you can say that immediately after your internship, you are capable of holding it on your own. And I know that some of this agenda that is being implemented by the Council of Governors was being pushed by people who do not understand what healthcare is, especially entrepreneurs who are coming and they are saying they want cheap available labor, and they are misadvising governors on what we should do, and they are misadvising governors because they want to open some small kiosks so that they employ doctors on some cheap labor. They misuse these doctors. That is a risk to every single citizen, because every single doctor needs to be experienced, and you can only be experienced through apprenticeship. So when I was talking about the governors, I meant the strikes that are going on. And I mentioned that these are no longer strikes, they are lockouts. And we are going to engage to ensure that those doctors can be returned to where they are needed. And the national government needs them. So we will return those doctors to where they are needed. And this has happened before. You remember in 2014, we returned all our doctors from Bomet to the national government. You see, and when the current governor came, she had to do a lot of efforts, and we want to thank her for that. She's one of those governors that have been very progressive in terms of now recruiting to fill that gap. And she has the governor of Bomet has recruited a lot of doctors to actually fill the gap that was left when those doctors left. You know, and that is exactly what we are going to do in Kirinyaga and Laikipia. But let those governors not, you know, it's very easy to call for a press conference like now and issue a lot of statements. But we should always interrogate as a country whether the person speaking is the one that needs help or is the one that is helping the people that he's speaking to. That's something that we really need to interrogate, because we as a union and as doctors, you will not bar us from seeing some symptoms of problems of people that need treatment. And some of them, unfortunately, are governors, especially like in Laikipia and Kirinyaga.